Our daily schedule includes convocation, prayer, and the Pledge of Allegiance. By doing so, we build a family-like community where all students grow and flourish and personal faith is encouraged. Through community service and a historical approach to biblical study, our students are taught the value of the warrior way, honesty, respect, and responsibility. Oak Mountain Academy.
Local stories you care about. WLBB, Carrollton, News Talk, 1330, FM 106.3.
Well, good Wednesday morning. It is now 9:30. This is the WLBB Community Voice here on News Talk 1330 FM 106.3. Also streaming live online at newstalk1330.com. And this morning we're on the News Talk 1330 WLBB Facebook page. Our guest this morning, a returning guest, hasn't been on for a couple of weeks, though. Dr. Laura Larson thought it's a good time to bring her back on. There were some numbers, some activities going on out there that may give us a little bit of hope that this pandemic is reaching a low point, perhaps. But there are also some scary numbers out there, and we're going to talk about those as well with Dr. Larson this morning. Let me introduce you to her, just to remind you who she is, even though most of you are pretty confident in who she is. Dr. Larson, Medical Director of Infection Prevention for Tanner Health System, board certified in infectious diseases, earned her medical degree from the Mercer University School of Medicine, completed her residency and fellowship at Shands Hospital at the University of Florida. She's an infectious disease specialist. Dr. Laura Larson, our guest on this morning's Community Voice. Dr. Larson, good morning. Dr. Larson, good morning. Steve Gradick, did you press that button? All right. Good morning, Dr. Larson.
Good morning.
There she is. Got to mention Steve Gradick pressing the buttons this morning. You're kind of pressing the buttons. Joel Brock is doing the Facebook Live for us this morning. Thank you for joining us here. It's been about 2 weeks, so perhaps there's some things that we can catch up on, because I know that you're saying a lot of the same things over and over again, and we're all asking the same questions. But hopefully today we can give some good, important information. First off, let's start off with what we do start off with every conversation with you. Tanner had released this little bit of data on yesterday. They do it every Tuesday. It talks about the number of patients that are hospitalized and deaths that have been reported at Tanner facilities, including in Bremen, Carrollton, Villa Rica, and Wedowee. And according to that data, 119 are currently hospitalized. 2% of those are vaccinated. 117 are unvaccinated or not fully vaccinated. And I guess I was going to ask you if we could break those numbers down, because I know there are questions. I guess what does not fully vaccinated mean? It just means, I guess, one of the shots when two is required.
Yeah, so actually for Pfizer and Moderna, to be fully vaccinated, you have to be 2 weeks after your second vaccine. And for the Johnson & Johnson, it's 2 weeks after your one vaccine. So a lot of people ask questions why we say fully vaccinated versus not vaccinated versus, how many people just had one shot. It's very, very few people that have had a single vaccine. So a lot of people are asking if, we have 119 admitted, 2 are vaccinated, how many of those had one shot? And our current numbers, it's only 1 or 2. So when we say not fully vaccinated, in most cases, it's not vaccinated at all.
Well, is there a way to chart those that are partially vaccinated in the group or those who were partially vaccinated and passed? Is there a way to show those numbers at all?
It's very difficult to do this dashboard already. Obviously, we're looking at these numbers every day, and it doesn't really matter because vaccinated means vaccinated. One vaccine is a lot less protective than the 2 vaccine for the Johnson & Johnson, the Moderna. So it's just easier for us to report it as vaccinated versus not vaccinated. And if you're not vaccinated, it means you're not fully vaccinated.
Also, can Tanner document how many of those in hospital and have passed had previously had COVID, though, and were expected to have had the antibodies to fight off the virus?
We can't. And the reason for that is you'd have to physically ask each of those patients if they've had COVID before. Most people don't know if they had an asymptomatic case, so we can't get an accurate number. We are actually going to do a study this fall, though, of actually calling our hospitalizations to see if they had COVID previously. We've also got our data analyst working on whether or not a patient has tested positive for COVID previously and then was admitted. The problem is that not everyone gets tested here. So we don't have a database of all patients that test positive for COVID to capture that once they're hospitalized. We know of a handful of patients that have been readmitted that have had COVID previously. It's not a large number, but again, that's a really hard that's a hard request to capture. Again, the way we're going to do that this fall is to physically have people called and hope that they'll comply with, answering our questions to see whether or not they've had COVID previously.
The numbers of deaths in the last 2 weeks, I believe the total number is 36. That's been reported at Tanner hospitals in the last 2 weeks. That seems to be like 20 this week and then maybe 16 the week before that. Those numbers seem to be higher than most every other week since February. Is there a reason that you believe that?
We're just having more people in with COVID. We had never had 119 people in the hospital. So, people that come in here are more sick with COVID. And so expectedly we'd see more deaths. And if you look at that, the last 2 weeks is 36. So we're on track for September to be over 60 deaths, and that's our highest month since the Delta variant. Last month we had 44 deaths. So we're just, this is what we see when we see a surge in cases, and the deaths follow, unfortunately.
Now, there is a small number of those who are vaccinated who have caught the illness and needed to be hospitalized, and of course, some that passed away. But out of those individuals, is there a good idea which vaccination fought better?
No, they're pretty much spread across the board. We actually looked at that, and it's about a third of each. So a third of Johnson & Johnson, a third of Moderna, and a third of Pfizer. We have not seen any one vaccine standing out as a failure or a better one.
All right, time right now is 8:35. What percentage of the area at last count did you see has been vaccinated?
When I last looked, it was about 32% for fully vaccinated. I don't remember the exact percentage of the single shot, but it was high. The single shot was more like 38%, but we're still pretty low with that number. Yeah,
I think when the masses started getting vaccinated, I think the number was up to 29%, so it hasn't budged a lot since then.
It has not. I think but that number does get reported as a delay. Because even though we're required to put in our vaccination status, the INTEGRITS or the Georgia Registry of Immunization, we have to put it in within 24 hours. It takes the state's data system a couple of weeks for those to show up. So I'm hoping we'll see that percentage go up in the next month.
Now, is there a mathematical equation in your head of how much the daily positive rate of COVID tests could drop? Like if the vax percentage went up just 1% or 2% or 10%. Same with the hospitalizations or death. Is there it's a promotional thing if it's if you can actually put a number out there.
The number that's being thrown out there is 70% of our population vaccinated, and I don't think that's necessarily attainable where we live. But where we live, we have a lot of people that have been infected, and I do think that infection does provide immunity. And we don't, again, we just don't know how much immunity and what that number looks like. So right now, if a bunch of people got vaccinated right now, it wouldn't necessarily drop our percentage right away because, for Moderna and Pfizer, it takes 6 weeks to be fully vaccinated. For J&J, it takes 2 weeks. So there's not I would imagine that we would start to see a significant increase in people being vaccinated now in the next month. But we're starting to see, hopefully, a tentative decline in our percentage right now. Our top percentage of cases was about 28% of people testing positive. In the last couple of days, it's dropped to about 20%. We hope that sustains and that we really are possibly on the decline. There's just no way to know until it happens.
And that was a question I was going to ask. I think a couple of weeks ago you told us that medical professionals believe that it would kind of top out, peak out in middle September.
Mm-hmm. Yes.
And that's about where we are right now. So I guess we're kind of just watching at this point since that number dropped a little bit.
We are. And I have some really smart friends that email me that are, physics professors and statisticians that actually look at these numbers independently of even what we're doing in the state because they're just that intelligent. And right now, at least for the information that I've been given, we haven't quite peaked yet, but I'm looking for the update this week.
As sad as it is to hear about the hospitalizations themselves and people on ventilators and the amount of deaths at the hospital, the total hospital occupancy affects everybody. It affects everybody who has any other condition that needs to be in the hospital. Villa Rica, 188%. Wadowee, 80%. Carrollton, 145%. And Bremen at 61%. I don't know where to go with that question as far as, how's everybody holding up? This is a constant battle, especially when you have 188% occupancy in Villa Rica.
We're doing okay. I mean, we're just doing our jobs, and it's the biggest complaint you get from patients is patients obviously don't like to be housed in a hallway, for their hospital care. But there's practically no hospital that you could go to right now where that's not the case. And so we're constantly working. I think that yesterday we were also working with state guidance on if we're able to house patients in certain areas of the hospitalization. There's different rules for ED beds versus hospital beds. So we're constantly working at trying to make this a more pleasant experience for everyone involved. But that's the major complaint is for a patient to be housed in a place that they're not used to.
What's the status for elective surgeries?
We're still doing them, and we have enough. The big thing for elective surgeries is having beds for them to go to after surgery, having ventilators, having anesthesia staff. And so we haven't been stretched to where we can't have people safely intubated and, for them to have surgery at this time.
Well, are those numbers lumped in with the total occupancy numbers?
Yes, they are. If they're admitted after surgery, they sure are.
Yeah. Well, I mean, then why wouldn't we remove those to lower those numbers? Why wouldn't we remove selective elective surgeries?
The problem was even last year, some elective surgeries were not that elective. And, if you have somebody that has, a tumor that needs to be removed that's not causing immediate problems now, it's not really elective. And we let the surgeons decide on whether or not they feel that a patient is going to have a delay in care. It's most of the time when we think of elective surgeries, we're thinking of people having, I don't know, cosmetic things or
things
that's
what I was picturing, sure.
Yeah. And we don't do a lot of that. Most of the surgeries that we have to do are ones that are needed. And again, I know a lot of the surgical colleagues, and if they feel a patient doesn't need to have surgery right now, they're not doing it.
Okay. Before we go take our first break, we'll try and end on a positive note. I believe that Tanner Health System learned that they're going to get 20 guardsmen from.
Yes, we have.
Okay.
They're actually here. And it's actually really exciting to see that because it kind of, it feels good to see them here. They've been helping us down in food services and environmental services, and everybody's like, well, why would they do that? Well, if we have 188% occupancy in a hospital, we need help at feeding all those patients. And so that's where they've been extremely helpful for us, and it's just wonderful to see them here.
Are any of them medical professionals?
As far as I know right now, no, not yet. We hear that some of them might be coming that are being medical, but my understanding is the 20 are not.
Okay. Time right now is 8:42. Our guest this morning is Dr. Laura Larson, infectious disease specialist with Tanner Health System. We're going to take our first break here. I'll take a look at the Facebook page and see if there's any questions that we can share with Dr. Larson this morning, and we'll try and get her to answer those for us. Community Voice brought to you by Tanner Health System and Oak Mountain Academy on News Talk 1330 FM 106.3.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
At Oak Mountain Academy, our academic excellence shines through innovation and a personalized educational experience. Our pre-K 3 through 12th grade environment offers a family-oriented atmosphere. We are an independent school with faith-based values and an academy honor code. Our academic standards prepare our students for college and beyond. I'm Patrick Duran, headmaster, inviting you to visit us on the mountain or at oakmountain.us. Come see how our warriors are creating legacies.
8:44 and welcome back to the WLBB Community Voice on News Talk 1330 FM 106.3, streaming live online at newstalk1330.com. This morning we're on the News Talk 1330 WLBB Facebook page. I'm your host, Colin Worthington. Our guest is Dr. Laura Larson with Tanner Health Systems. Looking to our Facebook page for some questions on here. Good morning, Holly Presnell. Thank you for tuning in. And good morning, Karen Frazier. She's got a question. What is Tanner's protocol when someone comes in the hospital and tests positive for COVID? What's the treatment plan, and is that posted on the website?
It's not posted because, no one, we're not cookie-cutter patients. Every patient has different needs, different underlying medical problems. So for a patient that comes in, it really depends on whether or not they have a degree of what we call hypoxemia or shortness of breath to determine the treatment course. If they're short of breath or not having good O2 stats, a lot of times those patients will be admitted. When they're admitted, they're given remdesivir. If they're severely ill, sometimes we'll do the IL-6 inhibitors. They get steroids. If they're not that ill and not that hypoxemic, we give them monoclonal antibodies. If they are at high risk for progression of severe disease, and in some cases, if they have underlying lung problems and shortness of breath, we'll also give them some steroids. It's a very individual basis on how they're seen, triaged, and how they're treated.
Debbie Neal watching us on Facebook Live this morning as well. She wants to know your opinion on the booster shot. How long after your last shot do you think it's important to have this done?
I think they're still looking at this, and I'll tell you, it's I think 6 to 8 months is reasonable, but I do think that the reason why there's some hesitancy and discussion with boosters is whether or not the booster should be a lower dose of the shot. We do know from the mRNA vaccines that there are instances of myositis, which is a inflammation of the heart. We know COVID itself causes significant inflammation of the heart in the bloodstream because it's where it attaches to those. So, you would know that the vaccine is based on the same spike protein, and we've seen some cases of myositis following vaccination. So that's the million-dollar question is, are we going to recommend a lower dose for the booster to try to reduce the incidence of myositis happening, or is the low number of cases that's happening acceptable? And so I think that's why there's a lot of discussion within the FDA and science community on, I think we all agree in general that a booster is needed, but whether or not that booster needs to be a lower dose or a different vaccine, that's what's currently being studied. I'm in the Moderna trial, and I am, I'm 13 months out from my vaccination. I go in a couple weeks from my appointment, and I'll be very curious to see what they're talking about with booster or not, because, we're a group of 30,000 people that are being studied right now. Over 1 million U.S. citizens have gotten boosters already. Most of them are going through, the CDC's recommendation of being immune compromised. So it's really just kind of a moving target right now. We thought that boosters were going to be recommended across the board, and then there's been some more information that's come out that's kind of made everybody slow down and let's see how to do this safely. Kelly
Sapp watching us, and she asked a similar question, so hopefully you answered that for her. How often do you get your antibodies checked, you personally?
I don't. I haven't.
Okay.
It doesn't matter for me. I mean, I didn't get, I got my antibodies checked about a month after when I was vaccinated. I haven't since then because, number one, I'm in a trial, and it's not going to affect, I'm going to follow my trial to determine whether or not I need a booster. And I'm just very careful at the hospital. I wear an N95 with every patient. I wear eye protection with every patient. With COVID patients, I also wear, a gown and gloves. I'm not really social right now, and so that's the reason I really haven't, because it doesn't matter. If I have undetectable antibody, it's not going to change what I'm going to do right now.
I guess I was wondering if there's anybody locally who's monitoring their own to see how they change over a period.
I know a lot of patients are, and physicians are ordering them for them. And especially some of our patients that are immunocompromised have had their antibodies tested and they're undetectable, and have, obviously that's led their decision to go ahead and get the booster, because that's the group we're doing boosters for right now. The hard thing is you have to make sure you're doing the right antibody too, because, not every antibody test will detect what that vaccine stimulated. So you also have to make sure that if you're getting those done, you're getting the correct antibody to pick up that vaccine response.
All right, Amber Shaw Nixon is watching us on the News Talk 1330 Facebook page. She says, Dr. Laura mentioned she does believe infection creates some level of natural immunity. Given the population seems to be choosing to delay getting the vaccine, why not go ahead and add a question to admitted patients as to whether they have previously been infected with COVID? Yeah, you'd mentioned that that's kind of hard to document if they want to be honest about it. The COVID positive test may not be in your Tanner database, but it can be shown in your summary as an asterisk self-reported confirmed previous infection. We're looking at that this fall with having a specific, student doing that. It's not necessary to be on the admission database. We are trying to figure out how best to do that. And it's, if you've been a nurse, you know what the admission database looks like anyway. It's a long, lengthy process. To add to that when we already have short staff is not necessarily something we want to do.
That's why we want to have an independent, study done and not add more burden to our nurses.
Okay, before we take our final break for this segment, Beth Lassiter, how many COVID patients are getting the monoclonal infusion?
I know a lot of them are. I know we have 40 or 50 waitlisted as of yesterday, and we're giving as much as we can get. The problem with the monoclonal antibody is it's on allocation, which means that we're just getting smaller amounts of it. Again, that's happening across the board in hospitals now. We had plenty of it a couple of months ago, and just had it sitting on our shelves. But we're giving, monoclonal antibodies significantly to the point that now there's a wait list.
Okay, time right now is 8:50. We're going to take our final break here and continue our conversation with Dr. Laura Larson of Tanner Health System. Community Voice brought to you by Tanner Health System, Oak Mountain Academy, News Talk 1330, FM 106.3.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
As a graduate of Oak Mountain Academy, I've found that my experience on the mountain prepared me beyond all expectations. As a junior at Auburn University, I approached my studies with great confidence thanks to what I learned at OMA. When I think back on my time on the mountain, I think of my teachers. Their genuine love and concern for me as a student was always evident, and now, as an adult, I still foster those relationships. I'm Carly Robinson, an Oak Mountain Academy alum. Visit oakmountain.us to see how you can offer your child an amazing opportunity to be a warrior.
8:51. Welcome back to the WLBB Community Voice. I'm your host, Colin Worthington. Got about 8 minutes left in our program this morning with Dr. Laura Larson, Medical Director of Infection Prevention for Tanner Health System. If you go to the USDA Food and Drug Administration website, it says overall the vaccine was 91% effective in preventing COVID disease. That's the Comirnaty. Is that what they're calling it now?
The what? I'm sorry?
Comirnaty? Which vaccine is that?
Oh, no, that's Pfizer. That's the new name.
That's the Pfizer, right.
That's
okay.
the Pfizer vaccine.
Do we have to get used to people saying that or trying to say that?
Yeah, I'm just starting to learn it myself.
Okay. Well, overall, it says the vaccine was 91% effective in preventing COVID-19 disease. And I wonder if that last word there, it's important that it's put out there. So, I mean, in preventing disease, 91%, does that mean that it's not 91% effective in protecting you from acquiring the virus, but maybe 91% effective in keeping you from getting the symptoms or extremely ill?
The initial numbers of the 91 to 94% were to prevent you from actually getting disease. And that was, that's how we're monitored in the clinical trial. So, we're vaccinated. If we come down with symptoms consistent with COVID, we have to report back to our center. We get tested. And if we have symptoms and test positive, that's where they get that percentage of the protection. What's really important to especially note now with the Delta variant, which lowered the efficacy of getting the disease, is that vaccines are most important at preventing severe illness, hospitalizations, and death. I have a lot of people that say, well, why get it if I'm going to get COVID anyway? It's that piece. It's that piece of severe illness, hospitalizations, and death. The flu shot is not, the endpoint of study for the flu shot is not to prevent the flu. It's preventing people from dying of pneumonia. That's the endpoint of flu shot. It reduces your chance of dying from pneumonia following flu infection by 50%. And so there's always a different endpoint from the vaccination than just prevention of the disease itself. It's prevention of severe disease.
Autumn is typically big event season, festival season. We've got high school football back in action, college football, pro football back in action. We saw the stadiums were packed over this weekend. It does kind of give an image that we're moving out of the pandemic. I guess what's your advice for being part of these festivals that we'll have locally and the football games that people are determined to attend?
So obviously, if you have underlying medical conditions that make it more likely for you to get very sick, please consider vaccination. I strongly feel that way, especially for people that have a body mass index over 25, that are diabetic, that have underlying heart conditions. Obesity is a huge factor for death for us, even in young, healthy people otherwise. So I really feel like, number one, get your vaccine if you're at risk. It's very, very important. And, consider your circumstance. Obviously I tell people, stay away from those that are sick. If you can wear a mask and socially distance, great. You can't easily do that at football games. Obviously, things being outdoor are safer than indoor things. But, again, vaccination seems to be our only true thing that helps reduce the severity of disease.
You said the numbers had dropped off, I think 28 to 20% positive test rate as far as COVID. But you're reluctant to say that you're convinced that it's going to keep dropping. Is that those outdoor events like football games and the festivals that are planned, or is that the kind of thing that makes you hesitant to say it's going to keep lowering?
Really, just because COVID has not followed any rule book for us since this began. We had the wave initially last April, then we had a wave again in December and January, and then we had a wave, again this summer. So it's one of those things. The waves are hard to predict. And so obviously, in addition to that, you have the emergence of variants that are hard to predict. And so it's one of those things that I'm always hesitant to say because I don't know what's around the corner with this particular infection.
And flu season is approaching, if it's not already here. So inevitably, there's some people, on social media and questioning you guys. I'm sure if not all the positive COVID cases could be flu, and maybe the deaths are related to flu or the hospitalizations related to flu. What is your response to that?
We have really good tests for flu. We have molecular tests for flu, and we are seeing flu. It's really kind of interesting. If you look at there's a site called FluView, which is the Cdc Spike for flu activity. And 2 weeks ago, Georgia was the number one state in the United States for flu activity. So we have actually pulled our numbers, and we are seeing flu cases. And those tests are independent of the COVID cases. So they're two completely separate tests. They aren't all lumped in. They have, they all have respiratory symptoms that can be similar, but we have very good tests to differentiate COVID from flu. We've
got about 3 minutes left in the program. You're also director of the Carroll County Board of Health. When was the last conversation that you had with local school systems regarding COVID, and any discussion as far as a mask mandate for those other systems that currently don't have a mask mandate?
We actually meet with the school systems every Tuesday at 4 p.m. It's a community call that we do, and Carrollton City, Carroll County, Oak Mountain Academy, Bremen City, Haralson County, they're all included in these conversations, so they're aware of the numbers, and I know that they're all monitoring that situation significantly. Mask mandates are very hard to enforce, especially if it's something that the state doesn't want to do, but all we can do is provide information and let people make these decisions. We are going to meet as Carroll County Board of Health meets in a couple of weeks, and we're going to be discussing the measures that we support. But we can make recommendations. We can't necessarily enforce them because that enforcing process takes a lot of leaders and a lot of community involvement.
And I guess this could be a positive number, although there's other factors to consider. Carroll County School System, it's our largest local school system, I believe 15,000 students. It dropped from 2.5% positive COVID reported about 2 weeks ago to 0.8% of students this past week. I mean,
and some of the schools have gone virtual too, help with that as well. I mean, so I feel like the schools are responding.
All right. Dr. Laura Larson, our guest on this morning's Community Voice program. Thank you for talking a lot with us this morning and rushing through all this. It's hard to get all the information we want in a half hour, but I appreciate you always doing it for us.
Thank you.
And I believe we have you scheduled for next Tuesday to come back on the show.
That's right. That's right.
All right, Doc. Thank you very much.
Thank you.
And thank you for listening to this morning's Community Voice program here on News Talk 1330, FM 106.3. Any other questions and comments, feel free to post those on the Facebook page. Sometimes Tanner's able to go back and look at those and answer those for you. Tomorrow, our guest, very interesting guest. I do encourage you to tune in for that program, Community Voice, at 8:30, right here on News Talk 1330, FM 106.3.